We're able to provide a life-saving technology to patients who otherwise would not receive treatment here in Oregon. They would have to travel to other states, might be Washington State, might be California, but that's obviously inconvenient and sometimes impossible. But the ability to access this level of technology here in Oregon is literally life-saving for them. Mr. Benjamin Weiner is a very lovely 91-year-old gentleman who is incredibly active, was exercising at the gym until last spring. He'd do half an hour on the exercycle, 5 days a week. But since then, it's been getting really run down, really short of breath, very winded, and just extremely fatigued all the time. And that's certainly due to his severe aortic stenosis. So clearly, he was at a point in his life where the disease was limiting him and his quality of life and his survival, and he was willing to do something about it. Just like with open heart surgery, we need to stop the heart or come close to stopping the heart before we put the valve in place. And we do that by actually making the heart beat very quickly. So what we do to make the heart beat fast is we just simply put in a temporary pacemaker. Turn it up and we program the rate of that little pacemaker to go to 180 beats per minute. And then that causes the heart to quiver. Essentially, it's at a standstill. So it's at that moment that we feel comfortable to actually deploy the valve. And we get it there by mounting it to a balloon. And we just crimp it on a balloon so it's nice and tight, and it's about the size of a pencil, maybe a little bit bigger than that. And that's small enough that we can tease it into the femoral artery and use that to get up and put it into position through the aortic valve. And then when we're sure that we've got it really well opposed, we deflate the valve, deflate the balloon, and that allows the valve to then start to work. We're the first center in the state to do it. This is too important, and this disease is too widespread. However successful we are with our outcomes, we're not going to be able to satisfy the demand for this technology all by ourselves. So we're looking forward to working with other centers of excellence around the state as their programs come up, in the future. But for now, this is a game changer.